So why is COVID still spreading fast in Kenya? One is limited knowledge and awareness of COVID. And to a large extent, you still get arguments that COVID is a hoax, doesn't exist. But more importantly, we have social stigma, which is still in. That is deep-seated cultural values. For example, beliefs related to circumcision. The other day, we saw some section of the community defying the government so that they could conduct the circumcision rituals. There's also the high cost of testing. In Kenya, my simple estimate and the available evidence suggests that we have who are being charged between 2,000 Kenya shillings to 13,500, which is equivalent to $20 to $150, depending on the facility. And you may need to notice that the NHIF hospital, the National Hospital Insurance Fund, which covers most people in the public sector, and most insurance companies do not cover the cost of testing. And therefore, this limits the scope of testing. And which means that there are people who are still spreading the virus even unknowingly. And even if they wanted, probably they could not afford it. Because you need to look at this cost against the minimum wages, and you could also invite the element of the poverty line. Fifth thing is social inequalities and economic marginalization of large segments of population. And this can be manifested in congested housing and overcrowding public places, particular markets, which means therefore protection becomes a bit difficult. Then we have lack or weak social protection mechanisms to cushion the poor and economically disadvantaged members, particularly jobless and unemployed, the persons with disability and the aged. Because inevitably what this means, then you have to travel and you are going to be in. So you start by traveling in a risky environment, using risk means, and you go even to a risk working environment where probably there is no sanitation facility, there are not so many other, there is no water. And then we have comorbidities. Segments of the population, particularly the old, have underlying conditions such as heart failures, coronary heart diseases, diabetes, kidney, obesity, sickle cell diseases, and others even have HIV, and therefore their systems are compromised. And therefore, COVID comes as an additional burden. Then we have lack of access to quality and affordable masks, which are particularly among the poor. Of course, they look like, initially they were exorbitant and far out beyond their reach. But people can afford a bit of them, but not entirely. The question is, what is the quality of this? The other element is lack of access to protective equipment, and this has become particularly a thorny issue among healthcare providers, and we are seeing a continued increase in mortality among health workers, and largely because the quality of the same facilities, even access is also limited of the PPEs. Then we have lack of sufficient health systems and public capacities for detection, testing, isolation, and quarantine. And we all know about, in Kenya, you know about the national government concerns. How many beds do we have? We are also talking of demotivated healthcare workers due to lack of insurance. Most of them are not insured. Then there are delayed salaries on payment of risk allowances, and we are constantly being treated persistent strikes of health personnel in virtually all, everywhere in the country. And every day it is the news. You move to the workplace. We also have lack of preventive or protective systems and the programs in most workplaces. And finally, we probably have a growing fatigue with the COVID. And the people have let their guards loose. They almost say, they become fatalistic in a way that let it be what it must be. Let me summarize in a way and very quickly. What is the role of social sciences in the COVID response? It can help in understanding processes which social, behavioral, economic, and environmental factors influence transmission of COVID. The second, they can also help discover mechanisms which can tamper, interrupt, accentuate, or modify these transmissions. They can also help develop interventions which harness this mechanism to improve public health and reduce the spread. They can also, social sciences can help in evaluating interventions, because we have tried many interventions, but how many of us know how effective these interventions and politics are? And it is basically the role of social scientists to be able to identify what are the weaknesses in this, so that we can stop the spreading of COVID. And finally, they can help to influence policy and practices by communicating results and implications of research to policy, to policy people, policy makers, to professionals, and even sometimes to lay audiences, because social scientists can be able to scale their understanding down to a level where they can be able to talk to lay people. One of the prescriptions is that people should isolate, quarantine themselves. And if you go to the Bible, which I'm a little aware of, I don't know much about the Quran and other religious beliefs, you will find that quarantine is in the Bible. And Isaiah 26:20 says, "Go home, my people, and lock your doors, hide yourselves for a little while, or until the Lord's anger has passed."